I first worked with Christina and Jay when Jay was less than 24 hours old. I came to help at home to try to get him latched. We were having challenges getting him latched at the birthing center. So I noted when I met him that he had a pretty deeply recessed chin. So his chin was kind of far back, which just makes getting a deep latch even a little more challenging. So I was kind of focused in on that from the beginning and kind of inside hoping that, all right, we can work around this. Didn't really, I know I did check his suck out at that point, at that visit, but he was still just 1 day old, so, you know, so much happens and changes in those first few days of life, and the more, you know, you do get a baby to breast, you know, they learn a better suck and these sorts of things. So I remember in the back of my mind thinking, oh, I hope that his tongue is not an issue, you know, tongue mobility is not an issue too, but obviously if the chin's back further, then the tongue can't extrude as far out, so we just worked with different tricks that we know that can help a baby compensate and do the best they can do, you know, in getting a deep latch. So what things do you remember that you found helpful to get him on the breast and get him working there?
Definitely required a lot of assistance every time. So right off the bat, you showed me kind of how to help kind of work the nipple into his mouth.
Yeah, kind of that flipping, sort of ridging the tissue and then flipping it into his mouth.
That helped a lot, and then gave me some ideas for a bunch of different positions. So we were constantly switching the position with Jay, and that actually worked better than just doing the same position. Possibly because he was getting tired in one position.
That's right. In one side he seemed to like one position, the other he liked a different position. Yeah. That may just be how he was able to, you know, get a better deep latch, you know, on that side, because all of his tissues being sort of tight, his muscles being tight, can definitely be affected by what side he's on.
Right. So that helped a lot. And then he pretty much, the first week of life, he really wasn't doing very well at latching. He had a couple of good feeds that, but it was mostly I think around day 3 when you put us on a bottle feeding schedule kind of around the clock to help recover some weight loss that he had had. And after that first week of pumping, and when his weight, he had gained weight after that, he was able to breastfeed much better and latch a little bit better on his own. But still, it was always with sucking, you know, always lots of air intake.
And were we hearing, remind me, did we hear clicking or just smacking sort of sounds when he was on the breast? All of it. All right, all those signs that he is taking in excess air.
Yeah, so, and then I think pretty early on in the first 2 or 3 weeks of his life, you did a pre and post feeding weight, and we were really surprised because he was only feeding for about 5 minutes. And he actually was taking in a little over 3 ounces during that. So we were both really
happily surprised that he did as well as he did.
Right.
With his challenge, you had been going to a chiropractor.
Right.
At what age did you start that?
Honestly, I think he was like 10 days old. And we went in and she did an assessment. And I kind of just took him in thinking I had this normal, healthy baby and that I was just doing it to optimize his feeding and his development. Then she came back with a big report saying that one of his cranial discs was, you know, kind of slipped out and that he was way more tight than a newborn should be, and that there's definitely was something going on. So she said maybe it was related to the trauma of just a long delivery, because it was a long labor. So still, again, no real insight that it might be a frenulum issue. So
right. So in the beginning, you know, when we're dealing with newborns, some babies can overcome, you know, things that may outwardly appear to be a big challenge, and sometimes, like, once he kind of got going, he was taking 3 ounces of the breast when he was a young guy, which is kind of surprising. Okay, so I think that in addition, your pumping, it was key in the beginning. You knew to pump so that you could protect your milk supply. you know, while we're trying to get him more effectively transferring milk. At what point did you feel like something just isn't quite right, or there's something more that can be done, or is this really the way it's supposed to be?
Right. I think reality started setting in when the idea that I was going to go back to work, right when he was you know, approaching 3 months, going back to work, and he wasn't nowhere close to sleeping through the night and just waking up around the clock. So this was around when he was 3 months old, and we had all three grandmas come and make comments about him, about how he might be kind of borderline colicky, and we had used natural gas relief medication
A lot.
like on a regular basis, daily.
Mm-hmm.
And that seemed to help a little bit, but it certainly didn't solve the problem. And also people had commented how much he was throwing up, and as new parents we didn't really know, you know,
How much is too much?
how much is too much, and pediatrician said all these things are normal, but looking back, the frequency and intensity of them were not normal. And so I think it was after really getting all that feedback from family around 2.5 months, when he was 2.5 months, and then approaching 3 months old, we thought that there must be something else kind of going on. And every time you'd go to the chiropractor and get an adjustment, we would have this magical night, or like this day and a half, where he did seem to sleep better. He didn't actually throw up as much, and but it never stuck. And so he would just go right back to normal within a couple days.
Okay, so I remember you verbalizing that you were concerned that he was getting such small bits of sleep,
Right.
you know, just throughout the whole day.
More so than losing food, because he was still gaining weight. So the
Yes,
weight gain was
again.
never an issue.
Right,
It
so
was
that's
just
sort of
the
what
sleep.
kept things under the radar enough. There were no real red flags when you go to doctor's appointments or anything, because he looked good, his weight was good, but it was all these issues you were dealing with at home.
So it wasn't until you really suggested that, you know, we could look into this, into the frenulum, and you had sent a couple of articles about it. And one of them was a link to a physician's page that had a ton of symptoms. And it said, your baby might have this if, and I looked through the symptoms, and the only ones that we didn't have was cracked or hurting or bleeding nipples and weight loss. But we had all of the other symptoms. And so that was kind of the aha moment that I bet you he has this.
Yes.
So.
So it was at that time, again, I didn't recommend, because as time went by, he seemed to be doing well. I hadn't really seen him other than just checking in by phone. But once you did verbalize, because it was always in the back of my head, once you verbalize, you know, that the feedings, he's still 3 months old and he's still waking so frequently, he is fussy a lot, he seems like he truly is uncomfortable. I remember you saying that you could just see his abdomen seemed hard, and he would pull his legs up, and he really just wasn't comfortable so many times after feedings.
Right.
He required lots of really vigorous soothing to try to calm him to sleep. I think those were like the big things where I kind of said, okay, by 3 months old, all right, this is worth getting checked out.
I think
and then I paid a little more attention when I came to visit at that time, as to just some tongue ties are so obvious that anybody looking at a tongue with a really obvious tongue tie where it is tethered basically almost to the tip of the tongue would look at it and say, oh, that's not right.
Right.
But his type of tongue tie, which is what they call a submucosal or posterior tongue tie, it does not look that way. So to the naked eye, when you lift the tongue, the normal person doesn't see that big sail or band of tissue there that might be short or tight. But you can't really visually see it, but you can see the limitation of his tongue. So that was the big thing, is that normal movement of his tongue was not possible.
Right.
And without that, you can't really so effectively remove milk from the breast. Now, he was able to, again, because you had a good milk supply and all these other compensatory things, he was able to get adequate feedings, and you were doing, you know, breast compression, sort of helping him get more milk when he was at the breast. But the key things were his discomfort. You said when he laid flat, he seemed like, he kept waking himself up, almost like, not, it didn't sound like he was choking, but you felt like he was kind of
coughing.
Yeah, coughing, working on clearing his airway.
Mm-hmm.
And you said he often had congestion, especially in the morning.
Yes, and apparently breastfed babies, that's common. Again, these are all common things. According, our pediatrician, who's excellent, said, stuffy nose is common, but again, I felt like it was so stuffy he really couldn't breathe.
Agreed.
And so it finally got to the point where the pediatrician said, well, I think maybe we should, I'm very against medication, but we should consider it for the acid reflux. And so she actually gave us a prescription, and I went to the pharmacy, had them just kind of fill it, and then, was texting with you, and really also trying to make an appointment at the chiropractor, trying to think, like, is there any last ditch effort we can do that's more naturalistic before we start almost 3 months old on major acid reflux medication.
Right.
So that was kind of the reality that something needs to change.
Were you hesitant when we talked about an ENT and possibly needing a clipping?
No, I was all for it. I did try to get a referral with our HMO through the pediatrician, but because he wasn't losing weight, we got denied. So we ended up having to go on our own and did it out of pocket. But we realized that the surgeon there said that he also had a significant lip tie as well. And I remember in the early days when I was learning how to breastfeed and you were giving me feedback that babies always can breathe no matter how much they're pressed into the breast. And I always kind of secretly felt like he wasn't breathing that well. And I realize now that his lip was never really making a little passageway for him to breathe as well as he could have. So he was always, I think maybe he was kind of pulling away sometimes just to get a breath too. So now that that has been altered, he actually looks very different, and his lip, when he feeds, his lip kind of folds out more, which was folding.
Fish lips, which
it was
is what we
out.
tried to get.
Yeah.
And pulling down his chin, were we doing that
Yes,
too?
we were doing
yes,
that.
we were doing all the typical
All
things
of
that
them.
you do to try to make a
And his lips
big
would go
difference.
out. They
Yes.
just,
Wouldn't stay.
Yeah.
Okay.
So they
All right,
just
so
didn't go out as much as
he
they do
compensated
now.
for a while. He
For a
compensated
while.
for a while.
And,
And then, so after the clipping, what did you notice, in kind of in what time frame?
Well, he just automatically, he kind of looked a little different, and he seemed more relaxed. He definitely was not spitting up as much. The coughing, he rarely ever coughs anymore. The congestion, instead of having to do a saline spray on his nose like 2 to 3 times during the course of the evening while he's sleeping, I maybe do it every 2 to 3 days.
Oh my goodness.
So just to kind of clear things out, instead of sleeping every hour to 2 hours, or waking up every hour to 2 hours throughout the night, he, on his worst night, that would be maybe half the night. So, but he's going, at least like a good 4 to 5 hour stretch in the beginning every night. And then waking up frequently after that, which we have to work on. But, and he still sometimes makes a sucking sound when he's feeding, but not every single time he feeds. And maybe just once or twice during the course of feeding. So, yeah.
Gas,
he still seems like he has some trouble with gas, but not to the same degree. And we actually just went on a long vacation, and we didn't even take the gas relief medication with us.
Okay,
so
and it's been a month since.
Yeah, it's been a month with him. Yeah. So, and it was a pretty quick. He really didn't like the aftercare stuff, but it was pretty quick healing.
Yeah. So the aftercare for how long did he really not like it at all? In the weeks?
Like 7 days.
7 days.
Yeah.
Okay.
Yeah. I mean, and then at that point, I think it was just he didn't like our finger in his mouth. But yeah, and it wasn't as awful as I had pictured. It was actually with a laser, so it's kind of cauterized instantly, and yeah. But so there's minimal bleeding, but it's very fast.
Okay.
Yeah.
Good deal. So he looks like a different baby.
Yes.
looks more relaxed, just looking at him.
Yeah, instead of getting the feedback from people that, oh, does he have colic? We get the feedback, your baby is, like, never cries, your baby is so chill. It's like...
You also had some challenges with bottle feeding. What did you notice when you were trying to bottle feed him?
So, you gave us some excellent techniques on how to actually kind of twist the bottle in so that his lips would be out and that he would get a good suction all the way around the nipple of the bottle. And so we would do the twisting and we would get him like that, but inevitably within, a few seconds it would kind of just pop back out. So we would twist it back in and it would pop back out. And so even on the bottle we could hear some sucking, or some sucking sounds, slurping sounds kind of. And so even at the bottle we felt like he was taking in air, even though it was better than at the breast.
An issue here. The Haberman feeder, did that one make any difference?
I think so.
Okay. And I just mentioned this because
So-
I know a lot of moms out there who are just trying to figure out what is going on,
A quick
are
fix
trying
too,
all
yeah.
kinds of different things. And, temporarily until you get things figured out, you want to use these compensatory things so that, you're getting the baby fed and trying to minimize the gas.
So when you had mentioned, that the frenulum, that this could be, a possibility, and sent me some of the links, and a link also to the Haberman feeder, I knew with my HMO that I was going to have to go to the pediatrician, and I was going to have to put in a referral for ENT, and it would be this whole long process, and I just wanted a quick fix. So we did get one of the Haberman nipples, and it was kind of our temporary fix for that.
That's to try and improve things
Just
short term.
just to see if he even had anything with the tongue, because we still hadn't had a surgeon look at it yet.
Right.
So, yeah,
You were trying to minimize gas, in every way you could. And your diet was pretty restricted at one
Yes.
point in time.
And I mean, that happened probably before he was even 2 months. But I already didn't eat a lot of dairy, but then I just made sure I had 0 dairy, because that was on the list. This was right before he turned 2 months, I think, that I went down to no peanuts, no hops, so no beer, no ginger, no coffee, which again I wasn't even having a lot of, but it was a really long list.
Yes.
But a lot of the major food groups that a lot of people would have, and I just 100%, I just really tried them out 100%. And again, we found it helped a little bit.
And that's why everything, because everything made a little bit of a difference.
It made a little bit
of a difference.
Yeah, but even doing everything, having the extreme restricted diet, till having his co-sleeper up at an angle for acid reflux, and not laying him down for an hour after we fed him, which was our pediatrician's recommendations. With the gas medication relief, like even with all of those things, and excellent lactation consulting, even with all of those things, they all helped. They just, there was still
Not enough.
it was not enough to overcome the frenulum issue. So
Okay, great.